I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're starting a series called Starting Gender Affirming Hormones, the Basic Information. In this series, we're going to take a look at hormones. We'll look at a review of the basic definitions of gender and gender dysphoria. Then we'll look at what is a hormone. Then what's a sex hormone. We'll take a look at puberty and secondary sexual characteristics. Then we'll turn to the masculinizing regimens and the feminizing regimens. And then finally, some pharmacology information about monitoring patient. But today we're going to start with the very basic information. Now, this information may be a review for many of you, but it will also help those of you who are new in this territory understand hormones in gender affirmation. We'll talk about the basic definitions of gender. We'll look at what is a hormone and then what is a sex hormone, as well as secondary sex characteristics and the processes of adrenarche and puberty. So it's really a lot of ground, but let's go ahead and get started. So all of this begins when a new baby is born and the delivering doctor or midwife says it's a boy, in which case the person is assigned male at birth, or AMAB. Or the delivering doctor or midwife says it's a girl, in which case the gender is assigned female and that person is an AFAB, or assigned female at birth. The assigned gender is always binary, that is to say male or female, and the assignment can be wrong. But let's look at basic definitions. So cisgender is when you identify your gender as the one that you were assigned at birth. So an AMAB identifies male and an AFAB identifies female. So I was assigned female at birth and I identify female, making me cisgender. Now you are transgender if you identify your gender as opposite from the gender you were assigned at birth. So an AMAB identifies as female and an assigned female, AFAB, identifies male. But it's not always so binary. Think of gender as a fluid continuum. You might think of male on one end and female on the other end. And these days, rather than using M2F or MTF, we're often saying feminizing. And rather than using the term FTM, or female to male, we're using the term masculinizing. What is gender dysphoria? Well, this is when a person identifies oneself as being other than the gender that was assigned at birth and feeling distress about that. Now, it's the dysphoria that's the problem, and dysphoria can be treated with gender affirming hormones and surgeries and other means.